Welcome. Did you know that if your blood sugar level remains high or you have diabetes, certain special signs may begin to appear in your feet? In this video, we will discuss top 10 important signs that appear on the feet that indicate diabetes, which you can observe in order to seek proper care or treatment earlier. So let's dive into the details of these signs. Number 1, numbness and tingling. If your feet feel numb, have a sensation like being pricked with needles, burning, pain, or stiffness, this could be due to excessive blood sugar damaging the nerves in your feet. This condition is called diabetic neuropathy. When blood sugar level remains high for a long period, it causes damage to the blood vessels, resulting in inflammation and damage to the nerves in the feet. Initially, this may seem like a minor inconvenience, but over time and without treatment, it becomes a serious issue. Numbness in the feet, along with crawling sensation like tiny ants, starts as mild discomfort but worsens over time. Because of this, your feet may feel warm or cold, become painful, and lose sensation, increasing the risk of foot injuries that you may not notice. Therefore, regular foot checks are crucial if you have diabetes or at risk for diabetes. With the early and proper intervention, nerve damage can be mitigated or slowed down. Foot care is vital in managing diabetes. Number 2, slow healing of wounds. Second, having wounds or injuries on the feet that take a long time to heal is a common but dangerous sign for those with diabetes. This highlights how essential proper wound care is for people with diabetes. When blood sugar levels are high, blood flow and the body's immune system are weakened. As a result, the wound area does not receive enough oxygen and nutrients, slowing down the healing process. Furthermore, because the immune system is compromised, it becomes harder for the body to fight infections. Simple wounds or blister can cause serious problems and lead to severe infections. Neglecting these kinds of wounds can result in even bigger problems. Therefore, ensure that your blood sugar levels are controlled, take care of your feet, and consult a doctor if any injuries occur. By regularly checking your feet and managing diabetes, you can avoid major issues like foot amputation due to severe foot wounds. Make sure to always pay close attention to the health of your feet. Number 3, edema. The third issue is the swelling of the feet and ankles, referred to as edema in medical terms. In diabetes, this swelling is typically caused by high blood sugar levels, which lead to poor blood circulation or damage to blood vessels, preventing proper blood flow to the feet. When blood flow to the feet is poor, water starts to accumulate under the feet, leading to swelling. Additionally, diabetes can affect the kidneys, weakening the ability to regulate water in the body, further intensifying the problem of swelling. Early recognition of foot swelling and proper diabetes management can prevent many complications. Swollen feet are not only associated with diabetes but can also pose risks to the entire body. Therefore, daily foot inspections are crucial. Number 4, dry and cracked skin. The fourth on the list is dry skin and cracked heels, which is not just a cosmetic issue for people with diabetes but also a vital health concern. High blood sugar levels can increase excessive water loss through urination, leading to dehydration. When the skin becomes dry, it loses its softness and elasticity, making it more prone to cracking. Cracked skin not only causes pain but also provides an entry point for microbes, potentially causing infections. In diabetes, the immune system is often compromised, increasing the likelihood of infection. Moreover, diabetes can damage nerves known as neuropathy, interfering with the body's natural ability to maintain soft, moisturized skin, thereby increasing the risk of dryness. It is essential to realize that dry skin and cracked heels are not trivial issues. Control your blood sugar levels, Inspect your feet daily, moisturize them, and pay attention to any changes. Number 5, cold feet. People with diabetes often feel cold feet, which can be a silent yet important symptom of diabetes. This is usually due to poor blood circulation. Prolonged high blood sugar levels can damage blood vessels and nerves, reducing blood flow to the feet. Without warm blood reaching the feet, they feel cold. Additionally, because of diabetes, nerve damage known as diabetic neuropathy can impair the body's proper perception of temperature. As a result, the feet might feel cold even when they are not. It is important to understand these symptoms and act accordingly. It is not just an issue of feeling cold, it's also a sign of the health of circulatory system and nerves. Blood sugar controls, regular walking and proper foot care can improve blood flow to the feet and help alleviate the sensation of coldness. Number 6, pain while walking. If you experience pain while walking, do not ignore it. It could be a sign of high blood sugar levels. Diabetes causes the narrowing of blood vessels and results in inflammation, which hinders the proper flow of blood to the feet and legs. When walking, the feet and muscles struggle to receive enough oxygen and energy, leading to pain. The pain worsens while walking and decreases when resting. This condition is called claudication. The pain could be an indication of poor blood flow and high blood sugar levels. If you have diabetic neuropathy nerve damage, this could also cause pain and numbness in the feet. Therefore, it is important to pay attention to this problem. To prevent more serious problems, you need to control your blood sugar levels, do exercise regularly, and follow your doctor's recommendation. Number 7, changes in foot shape. If you notice changes in the normal shape of your feet, such as curved toes, an uneven sole, or a non-flat appearance, these could be a sign of high blood sugar levels and diabetes. This often happens when the nerves weaken due to diabetes. When the nerves are damaged, the muscles can no longer move properly, causing the feet to lose their proper position. Changes in foot shape can also alter the way you walk, potentially causing excessive pressure on certain parts of the feet, which can result in blisters or wounds. If untreated, these wounds can lead to ulcers that might become serious. If you observe any changes in the shape of your feet, consult a doctor immediately. Wearing comfortable shoes, monitoring the condition of your feet daily, and controlling your sugar levels are effective way to prevent serious foot problems. Number 8, fungal infections. For individuals with diabetes, having fungal infections on the feet is common, and it is not just a simple problem but could be a serious warning. High blood sugar weakens the body's immune system, making it easier for fungus to grow, especially in the spaces between the toes where it is warm and damp. Such infections are also called athlete's foot. Symptoms include red, dry, cracked skin, and severe itching. For people with diabetes, such infections are more dangerous because the body's healing mechanisms are weaker and slower in fighting off microorganisms. Additionally, if there is neuropathy, there may be a lack of sensation in the feet, making it harder to notice the infection, and when it does occur, it takes a longer time to heal. It is crucial to understand that maintaining foot cleanliness is not just about hygiene, but is also part of managing diabetes. Daily foot inspections, keeping feet dry and clean, avoiding fungal infections, and controlling blood sugars are necessary steps to prevent infections and maintain healthy feet. Number 9, hair loss on toes and the lower part of legs. If you notice hair loss on your toes or the lower part of your legs, this could be one of the signs of diabetes. The usually cause is poor blood circulation. When your blood sugar levels are high, it can damage the blood vessels and cause inflammation. Consequently, blood may not properly reach your feet and legs. For hair follicles to grow properly, they need oxygen and nutrients from the blood. When blood flow is reduced, the air becomes weak and starts to fall out. If you experience hair loss on your toes or legs, maintain controlled glucose levels. Try to improve blood circulation, exercise regularly, and consult a doctor. Regular inspection and care for your feet are important. Number 10, changes in skin color. If you notice changes in the color of your feet, such as redness, yellowing, or a bluish tint, it could be caused by high blood sugar levels. This happens when blood circulation is impaired, possibly because of damage to the blood vessels resulting from high sugar levels. When blood does not sufficiently reach your feet, color changes can occur. If you observe unusual changes in foot color, don't ignore them. Get them checked immediately and ensure proper treatment for diabetes. When the skin does not receive proper blood circulation, less oxygen and nutrients reach it, causing alteration in skin colors. For example, if the skin turns blue, it may be due to lack of oxygen. If it turns red, it may indicate inflammation or infection. These changes in color are not just surface level issues but signs of internal effects of diabetes. If you notice strange discolorations, ensure your glucose is under control and consult a doctor right away. Daily foot inspection and proper diabetes management can help prevent complications. Thanks for watching the video and please subscribe to watch more. Have a nice day.